How many units of Botox do you actually need? Answer is, it depends. There isn't a one-size-fits-all number because Botox isn't dosed based on age or appearance alone. It's dosed based on your anatomy, your muscle strength, and your personal goals. Two people can have the exact same concern and need totally different treatment plans. Let's break it down by area. So for frown lines, which are 11s, between the eyebrows, many people receive somewhere around 20 Botox units. Some people need less, some people need more, all dependent on how strong those muscles are. For the forehead, treatment can vary. Some people are very expressive in the forehead, and while others only need a small amount. One of my biggest priorities here is maintaining balance. If we relax the forehead, we also have to evaluate the muscles that pull the brows downward so everything works and feels natural together. For crow's feet, the amount depends on how much movement you have here when you smile and what's occurring at rest. Patients often with stronger muscle activity need more than someone with very soft, subtle expression lines. Moving into lower face, a lip flip typically uses a few carefully placed units around the upper lip. The goal isn't that it makes it physically bigger, but that's what filler does. A lip flip simply relaxes the muscle, allowing the upper lip to gently roll outward. And then chin. Sometimes we call it pepple chin. Small amount of Botox here can help smooth that muscle activity and just create a smooth appearance. Then there's masseter muscles, located at the angle of the jaw. These muscles are incredibly powerful and variable from person to person. So someone who's clenching or grinding their teeth a lot may have much larger, stronger muscles and require a significant amount more of Botox units, as opposed to someone that's just going after subtle facial slimming. So why does one friend get 30 units and someone gets 50? Because Botox is not about copying someone else's numbers. Your muscle anatomy is unique, your facial expressions are unique. Even factors such as your muscle strength, metabolism, your previous treatments, and your overall goals will influence how many units are appropriate for you. This is why I tell patients not to compare their treatment plans to someone else. If you're a first-time Botox patient with me, here's what you can expect. At your initial consultation, we'll spend time talking about your goals. I'll watch your facial expressions when you smile, frown, raise your eyebrows, and even relax your face. This is a dynamic assessment, and it tells me far more than simply looking at you while you're sitting still. From there, I'll create a customized treatment plan based on your anatomy. My goal is to soften unwanted muscle movement while preserving your natural facial expression, not making you look frozen. After treatment, Botox isn't an instant gratification. You'll usually begin noticing changes within several days to weeks, and then full effect at 2 to 3 weeks, which is why I like a good follow-up. At that appointment, we reassess everything and see how your muscles responded to treatment. Everyone metabolizes Botox a little different, and occasionally a muscle may be stronger than we predicted and just needs a tiny adjustment to create that symmetry again. If appropriate, we make those refinements then. Think of it as fine-tuning your treatment rather than expecting perfection on day one. The best Botox treatments are personalized, balanced, and designed specifically for your face, not anyone else's. If you've been wondering how many units you need, the best place to start is with a consultation. We'll evaluate your facial anatomy together, talk through your goals, and map out exactly how many units make sense for you. I'd love to help you create a treatment plan that's tailored specifically. If you're interested in booking a consultation, please contact us at hello@selfskinstudio.com or give us a call at 910-945-0123. See you soon.